Hi everyone, it's Dr. Shika here from Verve. I'm just here today to give you a rundown on COVID vaccine exemptions and when our doctors can and can't provide them. So you'll all know that some industries have recently made COVID-19 vaccination a condition of employment because being unvaccinated essentially increases the chance that you will either get COVID yourself and get very sick from it or transmit it to vulnerable members of the community. So this can include industries who are working with vulnerable people or in close proximity to one another. So this includes things like healthcare, aged care, schools, childcare, and construction. So as GPs, we can only give you an exemption for a few very specific reasons. And none of these include things like not wanting it, not liking it, being pregnant or breastfeeding, or being concerned about things that you've heard about it. But we definitely are open to having consults with you to discuss your concerns about the vaccine, and we can present you with accurate information that may help alleviate your concerns. But none of our doctors will be writing vaccine exemptions for any reasons other than the ones that I'm going to go through today. So firstly, the only absolute reason not to have a COVID-19 vaccine is if you had had the first dose and you had a serious anaphylactic reaction to it, or if you are already known to have had an anaphylaxis reaction to one of the components of the vaccine that's been confirmed in the past. Both of these things are exceptionally rare and they usually cause involvement of an allergy specialist, so you will know if it's happened to you. Other than that, there are a few specific reasons that we can provide only temporary exemptions, and they can be provided for up to a 6-month period only. And the reasons that these can be provided are outlined in a specific ATAGI document, which I will share my screen to show you now. All right, so this is the document here. So it's titled ATAGI Expanded Guidance on Acute Major Medical Conditions that Warrant a Temporary Medical Exemption, which is relevant for COVID-19 vaccines. So if we scroll down to here, essentially there's a list here that I'll go through. So for mRNA COVID-19 vaccines, which is at the moment Pfizer and Moderna, it essentially involves a list of cardiac illnesses, so conditions to do with the heart being inflamed, if they have happened within the last 6 months. So this can include myocarditis, pericarditis, endocarditis, acute rheumatic fever, or acute rheumatic heart disease with active inflammation of the heart muscle, or what we call acute decompensated heart failure. If you have had any of these things, you will know about it and will often be under the care of a cardiologist who will give further advice. For all other COVID-19 vaccines, including mRNA vaccines, they have said that if you have actually had COVID-19 infection, and that is if it has been confirmed on a nasal swab, you've tested PCR positive on the nasal swab, does not include anything to do with blood tests or previous serology showing antibodies. If we know when you had the infection, you had the symptoms and you had a positive test, then you can get a temporary vaccine exemption until you have completely recovered from the acute illness. And this time period can be up to 6 months, but is usually less than that. And it's still recommended that you get the vaccine as soon as possible after you recover from the acute illness, because we actually know that the antibody response soon after the acute illness is better. So it's better to have that booster with the vaccine soon after having the infection. And then, of course, if you've had a previous dose of a COVID-19 vaccine, whichever one it was, and you've had a serious adverse event that was attributed to that vaccine and no other cause was found. So the definition of this serious adverse event is also given quite clearly here. So it means that you must have been admitted to hospital or had a persistent or significant disability or incapacity. So it doesn't count things that were troublesome, annoying, but temporary and didn't land you in hospital. And it must have also been actually reported to a state or territory adverse event surveillance system. So we've got places in Victoria, SafeVic and VICSIS that we would refer anyone to if we suspected this sort of thing happening after a single dose of a COVID-19 vaccine. And then there must be a full assessment done of that, often including specialists to say that, yes, this was a serious adverse reaction. We've documented it's gone through all the procedures sometimes involving a specialist reviewing it, and they've all said that it's not safe to have a second dose of the vaccine. And then the final reason they've got here is if the person to be vaccinated is a risk to themselves or others during the actual vaccination process. So this can include things like severe neurodevelopmental conditions, for example, people with autism spectrum disorder. If we have to try and source some sort of specialist services that would be able to facilitate the actual safe administration of the vaccines, this is more to do with the procedure of giving the vaccine not being safe. Then again, we can give a temporary exemption until they're able to access those specialist services to arrange the vaccine. All right, so basically, bottom line, as doctors, we're not here to break any of the rules that have been set by the government to keep us safe. The vaccine is safe and the most effective way to keep yourself and your community safe from COVID. And that's what we're all trying to do during this pandemic. Thank you.